Good afternoon, everyone. I'm Dr. Shibangi, Ayurveda DS Research Center, Kolkata, and I'm honored to welcome you all for this important webinar happening during Breast Cancer Awareness Month. Today, we will be discussing a topic that touches millions of lives across the world. That's breast cancer. Breast cancer is not just a disease, it is a challenge that affects individuals, families, communities alike. But the good news is early detection and right knowledge helps us save many lives. In today's session, we will come across and we will share knowledge regarding both modern and traditional medicine so that we as BH Research Center believe that integration of modern medical advancement and traditional practice provides a holistic care to a cancer patient so that we can reach to this goal. We will be introducing our guest of the honor, Dr. Anchal, who is highly respectable practicing obstetrician and gynecologist who will be sharing her knowledge and medical aspect regarding breast cancer. Along with that, we are joined by Dr. Divya from DS Research Center, Bengaluru, who will be sharing the traditional medicine knowledge and how traditional medicine helps cancer patients. So, without further ado, I would like to thank everyone who has joined here and would always congratulate and tell that this shows their commitment to understand, to spread awareness, because taking out time to understand how the disease can be prevented, how we can help many people is something that should be welcomed and encouraged all the time. So thank you again, and we'll start with this session with small questions that frequently a layman or a woman comes across to understand what breast cancer is and how it can be prevented. I directly go to Dr. Anchal. Dr. Anchal, please explain what breast cancer is in terms of a very normal language so that a normal person or layman can understand what actually it is.
Hear me? Hello, can you hear me?
Yes, now we can hear you. Please.
Okay, good afternoon, everybody. Dr. Achal here. My name is Dr. Achal Agrawal Jain. I'm from Varanasi, and I'm here to spread knowledge and share my knowledge regarding breast cancer. As everybody knows, October is the Breast Cancer Awareness Month. So, coming directly, and thank you everyone for giving me this opportunity to share my knowledge and experience. So, coming directly to your question regarding what is breast cancer, breast cancer is the जो normal cells of the breast, they are जो है there are some changes in the cells, the normal dividing cells, they go under जो है DNA changes, and because of that the cells do not work normally and they become cancerous, excessive proliferation and DNA mutations. These are the various things that happen, the various risk factors are there, because of which the cells undergo some changes, because of which the cells do not function normally and it becomes breast cancer. And it is the second most common cancer in India in
Okay,
females.
I would like to add one more question to it. Does family history of breast cancer affect the risk of a patient or a woman to come across this
Definitely.
disease?
Definitely.
Please.
If you have a family history of breast cancer, you are at an increased risk of breast cancer. And the screening programs also differ in patients who have a risk factor, identifiable risk factor, which is the family history. Family history is direct relative or first degree or second degree relative. The first degree relative is your Sagi Masi, Mummy, your Sagi sister. And second degree is your Mummy ki Masi, Mummy ki Behan, is type se. So, matlab the first degree and second degree relative, both if any of them have history of breast cancer or ovarian cancer, because the genes responsible for breast ovarian cancer are also responsible for breast cancer. So, if you have a family history of breast cancer, if you come to know that whether there are specific genes BRCA, BRCA1 and 2 genes, we can get the testing done. Many if there is a patient of breast cancer, BRCA1 and 2 genetic testing is being done in all patients. And if the gene history is if the genes are positive, BRCA1 and 2, then the whole family should get annual mammograms, and of course they should follow the screening programs because they come at high risk.
Okay. Thank you so much. Thank you. So I'll go next to Dr. Divya. Dr. Divya, as we were discussing just before starting the session, that early detection becomes very helpful in saving many lives. Can you help us understand how early detection is possible? What are the steps that we can ask a woman to follow?
Yes. Most of the cases of breast cancer is detected during self examination. So it's very important for spreading awareness about self examination to everyone. And self examination includes two things: inspection and palpation. Now, in inspection, one has to stand in front of the mirror and see for the symmetry of the breast. If there is any change in the shape of it, any change in the of the breast needs to be seen, and any skin over the breast has any discoloration like black discoloration or redness needs to be seen. Nipples are inverted or nipples are swollen, this has to be observed. Is there any discharge from the nipple? It could be a blood discharge, it could be a watery discharge, it could be a pus discharge, that needs to be seen. Is there any wound on the breast? That has to be seen. With any discharge, that has to be seen. So this is about the inspection part. Then comes the palpation part. In the palpation, one has to press the breast tissue with their fingers. So right hand has to be used for examining the left breast. Left hand has to be used for examining the right breast. So it has to be pressed around the breast in a circular motion. So in front of the mirror, one has to press the breast tissues slowly around the breast and look for any nodules, either nodules or any pain while the palpation. So these two are very important, and this palpation has to be done once in standing position and also in the lying position. The same way it has to be done in the armpit also for knowing the lymph node enlargement. So these two are included in the self-examination of the breast. So if any of these signs or symptoms are seen, then one has to go to the concerned doctor, and usually mammogram, FNAC, biopsy, these investigations will confirm the diagnosis. Apart from this, there is a blood test called CA15-3, which is a tumor marker specific for breast cancer. So this is a blood test. This also gives us an indication about breast cancer. So with these aspects, if you know that this breast self examination has to be done once in a month, so after 20 years or every month, the female has to do the self examination, and that has to be done once the menstrual period finishes. That is maybe 3 to 5 days once the menstruation starts. Preferably after completion of menstrual period, one can do this examination. So by this, we can detect the breast cancer at the earliest. Even the simplest symptom can be addressed.
So, how frequently should a person do the self-examination?
Yeah, once in a month, self examination is to be done from the age of 20 till the lifetime.
Okay,
I would
okay.
like to add something like we
Yes,
generally
sure.
say that from the age of 20 to 40, you can do self breast
Okay.
examination every 3 months if you are not a high risk patient. And after 40 years, monthly breast examination should be done.
Okay.
Okay. Thank you for adding. So, I carry on with the questions to Dr. Anchal. Dr. Anjal, nowadays women are quite aware of their life, their reproductive health, gynecological health, everything. They are quite aware of it, and most of the times women are career oriented as well. So how the gynecological health or reproductive history helps us understand the risk of acquiring this disease, breast cancer.
Sorry. Reproductive health affects breast cancer. You are right. There are many risk factors for breast cancer. There are modifiable and non-modifiable risk factors. So, the reproductive factors which are affect the breast cancer, they are non-modifiable. Of course, you cannot help in that. Some of them, for example, early menarche, it is a risk factor. Early menarche and late menopause, these are the high risk factors for breast cancer. And not breastfeeding, not having any children, not breastfeeding is a high risk factor. Those who do not breastfeed, those who do not have children, early gravid operation, they come at a high risk. And those who take smoking or tobacco, alcohol, they also come in high risk factors. Obesity is one of the high risk factors, although does not directly is a reproductive factor, but it is a high risk factor.
Okay. So, can you elaborate a bit more about how breastfeeding helps reducing down the risk factor or risk?
Breastfeeding helps in reducing down the it is a known fact that the studies have been shown that the women those who breastfeed, they are at lower risk of breast cancer because the tissues are not that dense. Those who do not breastfeed, their tissues are more dense. And also the mammograms can skip the lesion. If the lesion is very small, the tumor is very small, early mammograms can skip that lesion also because the tissues are more dense over there. So the breastfeeding generally reduces the risk of breast cancer.
So I add one more question to you here. How oral contraceptives affect the risk of the breast cancer?
OCPs generally increase the risk of breast cancer, but prolonged use of OCP, short duration of course does not affect the risk factor, but the prolonged use of OCPs because we're adding exogenous hormones to the body, they increase the risk of breast cancer.
Uh, thank you so much. Next, I'll go to Dr. Divya. Dr. Divya, can you explain a bit more about how prevention can be followed? We do understand that cancer is not completely preventable, but how can we lower down the risk?
Any disease for preventive aspect, definitely for any disease for that matter, lifestyle modification is very important. So in lifestyle, if we see, oral contraceptives and hormonal pills, using it for a very prolonged period needs to be avoided. Tobacco, alcohol addiction, as it is a cause for all cancers, needs to be avoided. Breast giving birth for the child in the right age, so preferably within 30 years. So between 20 to 30 years is preferred age for giving birth to the child. And for the newborn baby, one has to breastfeed for the optimum time period. So preferably at least minimum 1 year breastfeeding is must. And then going to shifting to healthy food habits like more fruits, vegetables, and green leaves, moderate exercise, and managing the stress levels properly. So these are the aspects by which one can protect themselves from breast cancers, at least to reduce the risk of it.
Thank you, thank you. Dr. Anshul, how does age affect the risk of breast cancer? How does it affect, how aging or age affects the breast cancer?
Any age group can have breast cancer, and the age effects in the matter of the we talked about like childbearing at an older age has higher risk factor. And age I guess age has this relation only because patients of any age group can have breast cancer.
So, do you want to add something more how we can advise or you advise to the patients that uh, what should they be following in terms of diet or something that can help them reducing down the disease, physical activity or something like that?
As Dr. Divya talked about, that healthy lifestyle should be followed. Excessive obesity should not be there. Physical activity must be there. Proper diet, including your protein-rich diet, avoiding caffeine. Although caffeine is not known to cause the risk factor, but to increase the risk. But excessive use of caffeine should be avoided. Use of tobacco and smoking, alcohol, these should be avoided. And we should avoid what were we talking about? uh, Sorry, can you repeat the question we were talking about
I was just asking you how we can advise women or how you advise women to take
regarding
care
the
of
diet?
themselves. Yes, regarding diet, physical activity, and everything.
Yeah, physical activity should be there. We should avoid excessive weight gain. Obesity should be avoided. Physical activity must be there. Healthy diet should be taken in using fast food and oily fatty food should be avoided. And proper hygiene should be followed every time. And protein rich diet should be taken.
Uh, I would ask you one more question. This might be a bit technical or something, but it might help patients. There
Yeah.
are types of breast cancer. There are stages of breast cancer. Can you brief or give us a little idea, or people here, listening to this webinar, how type of cancer and stages of cancer affects and how early detection helps patients? That if the disease gets detected in earlier stage, how it helps
There can be two types of breast cancer. The breast cancer can happen in the ducts through which the milk is secretion, which is called ductal carcinoma, and it can occur in the lobules where the milk production takes place. That is called lobular carcinoma. These are the two types of breast cancer, and we divide breast cancer into five stages from 0 to 1. Earlier the stage when the breast cancer is diagnosed, earlier better is the prognosis of the patient. So, by the methods we talked about self breast examination, which is the most important thing. If we detect breast cancer in the earlier stages, the prognosis is much better. 90% of the breast cancer are curable if they are detected in the early stages.
this is what I wanted to have because it gives a hope and positive impact on people listening to it and
Of course,
thinking
the
about it.
breast cancer is totally curable if it is detected in the early stages with a
Thank you so
combination
much.
of surgery,
Uh,
chemotherapy, and radiotherapy.
okay. Then now I'll go to Dr. Divya. Dr. Divya, please tell me how traditional medicine, because you are a practitioner for a very long time, you have got your own experience regarding disease and traditional medicine. How traditional medicine is helping the cancer patients?
Ayurveda is not only a medical science. So, as everyone know, it is a life science. But what does it mean by life science? So, Ayurveda works on two aspects. That is, swastasya swastya rakshanam, aturasya vikara prashamanam, which means the first principle is protect, maintain, and enhance the health when you are healthy. The second principle is clear the disease when you are affected by diseases. Okay, so in the first principle, that is swastasya swastya rakshanam, what it says is regarding the lifestyle. So, what to eat, what not to eat, how much to sleep, how much to exercise, how to dress, how to speak to protect your physical health and your mental health. So, this comes under the first principle of maintaining and enhancing your physical and mental health. The second one, coming to the diseased part, so we have the medicinal plants which works on two principles again. So in certain plants work on a general basis. They are basically immunomodulators. It has an action on the whole body irrespective of the tissue or the organ. So it works on the whole body. Like for example, ashwagandha, amla, aloe vera. So they are all immunomodulators which works on the whole body. There are certain medicinal plants which are specific in action. So they show their action on the targeted organs. So particular medicinal plants work on particular organs. For example, Gokshura, plants like Gokshura, Punarnava works on kidneys. Vasa Kantakari works on lungs. Brahmi, Jatamamsi works on brain and nerves. Lodra and Shatavari works on uterus. So we have specific medicinal plants which works on specific organs. So here in DS Research Center, what we do is we make a combination of both type of medicinal plants. So specific medicines for specific organs are given for the organs which are affected by cancer. It could be a primary site, it could be a metastatic site. So if a particular organ is affected, so the medicinal plants which work as a targeted medicine, so that medicinal plants will be added. And along with that, we have the general immunomodulators also, which will improve the quality of life. It improves the appetite, it improves the energy levels, it improves the sleep quality, it improves the immunity. So when such things are improved, the quality of life improves. It gives the tolerating capacity for a patient who is undergoing a concurrent treatment. So this is one aspect. And then for those who have got the surgery done or the scans are normal with all other treatments, the scans are normal, but they are at a higher risk of recurrence. So in such patients, we can avoid the recurrence part. And a few people come to us with a life expectancy, like maybe 1 week, 1 month, or maximum 3 months, you might live. So, for such people, life extension has happened. So, quality of life improvement and increasing the life expectancy and then avoiding the recurrence. So, these are three major things that you can definitely expect from the DS treatment. So this is what I have seen in my practice so far.
Thank you so much, Dr. Divya.
And one
Dr.
more
Anshul,
thing I want to add that we our medicine doesn't interact with any of the allopathy medications because most of the people have this notion that well allopathy is taken, Ayurveda should not be taken, and there will be some interaction. So it is absolutely no. As long as it is a herbal medicine, it is there won't be any interaction between allopathy Ayurveda. In fact, if both system work together, it is more beneficial for the cancer patients.
thank you. Thank you so much, Dr. Divya. Great. Yes, at DS Research Center, we do believe that integration of medical advancement in terms of management of disease and inclusion of traditional medicines and practices helps and provides a holistic care to the cancer patient. Dr. Ansel, what are the recent or I would say what are the recent advancement in terms of management in cancer or breast cancer patients? What you have come across?
Surgery, there are two types of surgery. It can be breast conserving surgeries. Recently, you have many stages of cancer, like till third stage of cancer, breast conserving surgeries are now being done. Earlier, the breast conserving surgeries were not really that much done. New hormonal therapies have come up. We have come up with new hormones, new hormonal therapy, targeted therapies. Immunotherapies are still being on the testing basis. They are not being used, but targeted therapy and hormone therapies have been the recent advances.
Great. It has been, I would say it has been a wonderful webinar because we have tried to touch each and every point that woman comes across, the questions that come across the person's mind regarding breast cancer. Yes, it is very true. It is very true that early detection helps us save many multiple lives. And as you said, as Dr.
That
Anshul
is
said, that
the take home message, early detection.
yeah, the take home message would be this because it is the breast cancer awareness month. And more we have the knowledge about this disease, The more knowledge we can spread, we can help people understand, we can save more lives. Yes, this is very true that today's women have become aware about themselves, but having a proper knowledge, proper information helps them more. So thank you so much. I would like to thank both of you for giving us such a beautiful explanation regarding the series. I think each and every person who will be listening to it or will be coming across this webinar will understand it better because it has been very basic knowledge and everything is applicable in a normal routine life. So thank you so much. Thank you everyone for joining us. Thank you.
Thank you so much.
Thank you.